We are discussing ectopic pregnancy. This is Dr. Deepti Asthana. I'm Senior Consultant Gynecologist and Obstetrician in Fortis Hospital, Gurugram, and Director, Kalosa Clinic. Today we'll be discussing a very important topic called ectopic pregnancy. क्या होता है ये ectopic pregnancy और क्यों ये हम gynecologist के लिए एक alarming diagnosis है? This topic is most important in today's time when being sexually active at a young age is so common. And I feel very surprised when young girls just consume MTP pills without even any proper doctor's consult. ये बिना अल्ट्रासाउंड के pills consume कर लेती हैं and then when things go haywire, finally they visit us and we find out that it is an ectopic pregnancy. I've realized in my clinical practice that most of the patients are not even aware what this ectopic pregnancy is all about. Well, to avoid ending up in such situations, आज हम डिटेल में डिस्कस करते हैं ectopic pregnancy के बारे में. Now before I forget, please subscribe my channel Kalosa Gyne for regular videos related to female reproductive health and visit my website drdeeptiasthana.com and kalosaesthetics.com. Now, let us take a closer look at the anatomy and the physiology. So, I need to take help of this diagram. Now, typically, the egg gets fertilized in the middle part of the fallopian tube here and then travels down to get implanted in the upper part of the uterine cavity here. ये egg ट्यूब के मिडिल पार्ट में फर्टिलाइज होकर देन ट्रैवल करके यूट्रस में इम्प्लांट होता है. नाउ इट अल्टीमेटली अटैचेस टू द लाइनिंग ऑफ द यूट्रस, बट फॉर एनी रीजन अगर आपके ट्यूब्स डैमेज्ड हैं या फिर फर्टिलाइज्ड एग के ट्रैवल होने में कोई भी प्रॉब्लम है, देन आपकी प्रेगनेंसी यहाँ तक ट्रैवल नहीं कर पाएगी एंड इट गेट्स स्टक हियर ओनली, एंड दिस इज व्हाट इज कॉल्ड एज ectopic pregnancy. Hormonal imbalances or abnormal development of fertilized egg also play a part in having this. Now, actually, fallopian tube is not meant to hold a growing embryo and can't stretch like a uterus. They burst as the fertilized egg develops, leading to massive intra-abdominal hemorrhage, which is actually life-threatening. Now, what can be the other sites of ectopic pregnancy? I told you, fallopian tube, this is the most common site. The other sites which we have for ectopic pregnancies are ovarian tissues, ovary, abdominal cavity, and the lower part of the uterus, which is also called as cervix. Now, moving on, let us know what are the causes of ectopic pregnancy. क्यों होती है ये ectopic pregnancies? Now, the tubal pregnancy most commonly is due to damaged fallopian tubes by inflammation or infection. So, any pelvic inflammatory disease leading to damaged tubes can result in ectopic pregnancy. Now, as we all know, tuberculosis is so common in India. And also apart from this, chlamydial infection or gonorrheal infection, these can also damage the tubes. Now, previous ectopic pregnancy, this is also a risk factor. If you have already had a previous ectopic pregnancy before, then you are at a higher risk in your second pregnancy. Next is we have fertility treatments. Now, various studies suggest that women who have IVF or analogous treatments, they are more likely to have an ectopic gestation. Now, next risk factor is tubal surgery. Now, whenever we do any surgeries to correct fallopian tube, this increases the threat of an ectopic gestation. Next is the choice of birth control. Now, the chance of getting pregnant while using an intrauterine device is rare, but still, if you do get pregnant with IUD in place, it is more likely to be an ectopic. Tubal ligation also raises your threat, and if you become pregnant after these, please get an early investigation done to rule out ectopic pregnancy. Last but not the least, smoking. Cigarette smoking just before you get pregnant is also known to increase your threat of ectopic gestation. Now, coming to symptoms, आप कैसे ectopic pregnancy suspect करें clinically? Now, some patients may not notice any symptoms at first. Still, some women who have an ectopic gestation have the usual early symptoms and signs of pregnancy, early pregnancy, which is a missed period, off and on pain, lower abdomen and nausea are frequently the first warning signs of an ectopic gestation are frequent light vaginal bleeding and pelvic पेन। नो अगर प्रेगनेंसी पॉजिटिव के साथ आपको कांस्टेंट वजाइनल ब्लीड हो रही है एंड पेल्विक पेन एक्सपीरियंस हो रहा है तो तुरंत अपने डॉक्टर को मिले। Now some patients may feel dizzy, चक्कर आते उन्हें, they can have shoulder pain or an urge to have repeated bowel movement. If the blood leaks from the fallopian tube into the abdominal cavity, these are the frequent symptoms you experience. Now actually your specific symptoms depend on where the blood is collecting in the abdominal cavity. As already discussed, if the fertilized egg continues to grow in the fallopian tube, the tube is likely to rupture as the diameter of tube is not much. Rupture leads to heavy bleeding inside the tummy. Now symptoms of the event include fainting and shock, which are actually life-threatening. कई बार हमें इमरजेंसी में ऐसे पेशेंट्स मिलते हैं जो बिना मेंसेस मिस के कोलैप्स एंड फेंटिंग के साथ इमरजेंसी में आते हैं एंड बिलीव मी मोस्टली इनके डायग्नोस्टिक एक्टोपिक प्रेगनेंसी ही होते हैं. No wonder ruptured ectopic pregnancy is a medical emergency for us. Now, how do we diagnose this entity? So first is history and examination, as I told you. Next, if we come to investigations, blood beta HCG. This is an important hormone जो कि प्रेगनेंसी के हमें लेवल्स बताता है एंड वी चेक फॉर इट्स राइजिंग ट्रेंड. नॉर्मल प्रेगनेंसी में बीटा एचसीजी एवरी 48 आवर्स में डबल होता है, whereas in ectopic pregnancy it rises but doubling is not there. So please be suspicious if beta HCG doubling is not there in 2 days. Next is pelvic ultrasound. This will certainly clear the diagnosis if adnexal mass is seen. You may or may not have any pelvic fluid depending on whether your tubes have ruptured or not. आमतौर पे ट्यूब्स हमें स्कैन पर विजिबल नहीं होती हैं, बट अगर ट्यूबल मास बना हो तो वो हमें अल्ट्रासाउंड में जरूर दिख जाता है. Now coming to the treatment, अक्सर पेशेंट्स बहुत घबराए होते हैं कि everybody thinks कि एक्टोपिक प्रेगनेंसी हो गई मतलब कि हमें ट्यूब ही निकालना है एंड सर्जरी ही करानी है. But let me tell you, medical management is possible, but only if ectopic pregnancy is detected early in the course. When your tubes have not ruptured, your mass is not big and there is no blood in the pelvic cavity. अगर हम late detect कर रहे हैं जब tubes already ruptured हैं या फिर mass 3.54 cm से बड़ा है and beta HCG levels are too high, then surgery is the only option. Now, depending on your general condition, we can do the surgery laparoscopically or by open surgery. Now, what are the preventive steps? Now, all the measures to prevent pelvic infections, including sexually transmitted disease, should always be followed. Smoking should be prevented. Now, MTP is legal, we all know, but do it in the correct way after visiting your gynecologist and getting ultrasound done to confirm the site of pregnancy. Now, that's all in this video. For more information, visit my website drdeeptiasthana.com or colosaesthetics.com. Now subscribe to my channel if you like to receive regular updates on gynae related topics. Thank you and take care. Bye.